A very good morning to all of you from wherever you are. My name is Tom, and I'm an ambassador at Health Careers Live, and I'll be serving as your host for today's panel. Outside of the Health Careers Live team, I'm currently a postgraduate student in audiology at the University of Manchester, and I'm looking to pursue opportunities in clinical audiology with the NHS in the years to come. As an aspiring healthcare scientist supporting medical and healthcare professionals in my specialty field, I strongly believe in stable clinical learning environments that give trainees and early career professionals the opportunity to unlock growth, retention, and sustainable career pathways in healthcare. Joining me today on our panel are Afan, Layla, Charlene, Susanna, and Christian, all of whom are early career professionals currently working in various healthcare settings in the UK and in the Middle East. Our aim of today is to find out how early career professionals from the Middle East feel about adapting to new clinical environments following an extended time in a university or higher education setting, and how they aspire to find their niche within the NHS. I'll be asking our panelists a series of questions related to topics in early career healthcare. There'll be a chance for panelists to discuss ideas and interpret how that question relates to their chosen field. I'll then also invite viewers to ask their own panelist at the very end. So if you'd like to voice your question, please put it in the chat box at the end. Okay, so hello, good afternoon, good morning to everybody. The first question I'd like to ask then is, would you mind please introducing yourself and talking about your field or speciality? May I please start with Charlene, and we'll just go around the panel.
Yeah, hello, good morning and good afternoon, everyone. My name is Charlene. I was earlier working in the Middle East in the pre-hospital professional career path. But now that I've moved to the UK, I'm working as a registered nurse, but I've yet to get my license because I'm in the process of doing my OSCE preparation. And most likely by June end, I'll be getting my license in hand. So then I'll be a full-fledged registered nurse in the UK. So that's a small background about me, but later on you can discover more as we go in.
Thank you.
Hello, my name is Layla. I'm currently working as a staff nurse in Abu Dhabi, and I'm undertaking my master's degree in pediatric nursing. I'm currently in my clinical placement in Northern Ireland, Belfast, in collaboration with Queen's University. And that's it. Nice to meet you.
Hello, everybody. I'm Susanna. I'm from Jordan, and I'm an audiologist. I've carried out my bachelor's degree in audiology and speech pathology at Jordan University of Science and Technology, and I'm currently finishing off my master's also in audiology at the University of Manchester.
Good morning, everyone. I am Rafhan, I'm an A&E junior doctor in West London at the moment. I've been here for the last 2 years and previously have studied and worked in Saudi Arabia.
Oh, sorry, Chris, I think your mic is off. Would you mind turning it on? Thank you.
Oh, sorry. Yeah, sorry.
Okay.
Hi, everyone. Good morning. My name is Christian. You can call me Chris. So I came from Middle East and now currently working in NHS Trust in Exeter. Yep. So currently I'm in COVID ward.
Thank you very much. That's good. Okay, so the first question I'd like to ask you all then was, how were you exposed to your healthcare field in your country? If anyone would like to speak or just chip in, feel free. But if not, we can just go around the panel and ask. So how were you exposed to your healthcare field?
Okay, can I speak first? So,
of course, yes.
Are you saying like the difference from where I came from and where I am now?
I'm sorry, would you mind repeating that?
No, how am I exposed from?
If I rephrase the question, I really just want to know how you got into your healthcare profession, or what made you want to join it.
Oh, sorry. Okay.
No, that's fine.
Actually, it's a simple and silly answer. So I became a nurse because of my grandmother. Yep, I just wanted to take care of her when she got old. I mean, yep. Yep, I think that's basically it. That's why I became a nurse.
Okay, thank you. Uh, how about Layla? Would you mind telling me about this? How were you exposed to your healthcare profession?
I was exposed as a healthcare because my two of my sisters and my brother are nurses. So they would always come back home with a lot of stories and interesting scenarios that they would have at the hospital. So for me, I always thought that they are like superheroes to me because they will talk about a cardiac arrest that happened in ER and how they intervene. And I thought that I want to be like them. That's why I pursue being a nurse.
That's really good. Thank you very much. Susanna, would you mind telling me how you were exposed to audiology?
Work in the healthcare industry, but I knew medicine, dentistry, and pharmacy were not for me because, so much stress. So I did more research, asked some relatives, and I came across audiology. I couldn't get much information about audiology back then because it was not that popular back in Jordan. So I was like, okay, let's try audiology.
Very good. Thank you very much. Okay, so the next question I have then is, how did you qualify and begin your training? So after you discovered your field, how did you get into it? How did you qualify and start your training? Either through higher education or through clinical experience?
So can I speak up?
Of course,
Yeah.
yes.
Okay, so for me, it was basically like when I was in my college days, I discovered that nursing could be one of the best professions because it's the place where you can interact with a lot of people. You can be there to care for others because that's my nature of helping everyone. So I thought that that could be the best place for me. And then when I entered into the nursing field, I had to start from the basics. So I started as a diploma nurse, which took me like 3 years. And then I did my 2 years of training or like working to take gain experience. And then I continued my higher studies as a bachelor degree in nursing because I had that zeal in me that I need to study further. I also thought of doing my master's, but then circumstances were not in my favor. So I had to move directly to the Middle East to support my family. And then there was a big shift in my career because I was in the hospital and then I had to take up a challenge to work in the pre-hospital setting that was with the ambulance services. And I'm a person who's ready to take up challenges most of the time. So I thought, why not shift to a pre-hospital environment where I had to, assess the patient on the spot, give my provisional diagnosis, attend to his needs immediately, and be on a fast track, and then ship the patient to the hospital. So that was kind of a challenging environment for me. And I worked there for almost 13 years. And then even I like tried to upgrade my career. I became an educator as well. For the last 6 years, I was working as an educator. And then I thought, why not try something else? So then I got to know about NHS, and still, I was not very sure that I'll be here because I was planning a lot of other countries, Canada, New Zealand, but they were not giving me the opportunity to come in there because I was lacking my experience. Because once I became an educator for 6 years, there was a gap in my patient care. But I think NHS was the place where they recognized my caliber and they gave me a very good chance. So that's why I thought, like, okay, let me get into NHS environment and learn how is it to be back in the hospital environment. So it's a huge big shift for me. But again, it's challenging because I'm working with dementia patients right now, and it's a wonderful place to start my career with. But yes, if you ask me, I would still prefer educating, the young crowd which come in. So because if you give them if you have a good experience and you can share that experience and build upon the knowledge, I think you can have many more nurses. Because I think health industry really requires a lot of nurses right now because we are having lots of patients, lots of new diseases creeping in. And I think we can also make people aware of, health, educating them, because health education is very important in the community environment. So I think there's lots more if you are also in the education field. So this is what I want to pursue. And this is how I thought that nursing is the best profession ever, to be with the patients and to the public as well.
That's really wonderful. Thank you very much. And it's really interesting that you also mentioned how you got into that as well. So, talking about actually getting into the NHS, then, would you say that the qualification route in your country and the UK is similar or different? And I ask this question to anybody who would like to answer. Are the standards for getting into your healthcare profession similar or different in your country to the UK and the NHS? And why?
I think in my country, back in India, it all depends on the level of education that you are taking in. So, and there is a lot of difference. If you are a diploma holder, you are considered, I mean, the pay scale, if you go to see, it's quite different compared to a diploma or a bachelor's or even a master degree holder. But I guess in the NHS, what I figured out, I'm not sure if that's right because I'm here only since 2 months, but I think that once you have passed your OSCE and you have your license in hand, everyone is considered equal. And you are working equally at the same level until and unless you have your experience and you are able to upgrade yourself and you can reach different heights and different levels. I think here you have a lot of career opportunities. That's what I feel in the NHS. You have a growth. But when I was in the Middle East, there is like you are you can't grow that much. But I think here in the NHS you have a lot of growth opportunities. This is what I feel.
Thank you very much. That's very interesting. I'd like to know the perspective from someone with some medical experience as well. Rafan, would you mind telling me a
Yeah.
little bit about how the qualification route in medicine is different in your country and the UK?
So yeah, thanks, Tom. I think I'm the only medical faculty in the panel right now. So coming from the Middle East. So personally, I am Indian by origin, but I grew up in the Middle East. I studied there. I practiced there as well. And I echo what Charlene has just said as well, that in the Middle East, after a certain point, you end up in stagnation. And the opportunity sometimes available to some of the local people are much more than what some of the expats have to deal with. So personally, I worked after finishing my junior foundation training in Saudi Arabia. I worked a couple of years in A&E there, then worked in CCU, pediatric ITU, but there's no scope of developing your career further. So you can stay stagnant as a junior doctor for years and years and not get any growth. And that's where coming to the UK has changed things. So over the past few years, I am in West London. I'm working in A&E, and I'm so again, when you come to the UK in the medical side of things, you have either you can join training through HEE, which is you can find different. So personally, I want to go still in A&E. So with A&E, you can go through the 6 years of the training program that's there, or you can also choose to go from Caesar, which is kind of out of training, but you stay within the same trust. You get all the second months done, and that helps you promote within the department.
That's really wonderful. Thank you very much for that. Okay, so when moving to the UK, were there any specific challenges that you faced with regards to your chosen field? Did you have any problems or anything that you found challenging?
So I feel the biggest challenge for most people moving from anywhere, whether it be the Middle East or Southeast Asia or even the Indian subcontinent, is I feel two major things are acclimatization and assimilation. So at the moment in the department, I'm the junior doctor rep representing all the doctors, and we kind of hold monthly meets outside the hospital because over the 2 years I've been here, I've seen that a lot of people, one, apart from the weather and everything else, just acclimatizing to the environment and the people and the culture here is quite a big cultural shock from someone coming or seeded growing up in the Middle East. And yeah, it's for a lot of people hard to join in and merge with everyone, and then you feel people seclude themselves and kind of go, put themselves in the background, and you have to put an effort to bring them in the front.
That's really wonderful. Thank you very much. And Susanna, as a healthcare scientist, as an audiologist, would you say that there are any challenges about coming to the UK?
Well, I agree with Rafan about all the stuff he said, but I also want to add the challenges I faced when trying to work in the UK in my field. It was challenging because we had different qualification routes, as they all mentioned. Like in Jordan, my bachelor's degree would be enough to qualify me to work as an audiologist. But here in the UK, I needed to be registered with something like HCPC or something else, and there are many different qualification routes to that. But my degree was not enough, I'd say. So I had to put more effort into that. But because I came here to study, so I just dropped it.
Yeah, exactly. And that's something that I resonate with quite well, because originally I did not come from a healthcare background myself. So before I got into healthcare, I was a teacher. And during the pandemic, I had a big career change, and I decided to enter healthcare, and with Susanna in audiology. So I really had to kind of put my transferable skills there to sell myself into healthcare. And again, we do face those problems as finding different qualification routes and getting registration. So for myself as well, that was a big challenge. But it's very interesting to see that we share those similar problems then, coming from different countries. So that's very interesting. Okay, so what was the best thing then? So moving away from challenges, what were the best things or benefits about moving to the UK to continue developing your clinical skills? Can I ask Layla for this question?
What is the best thing?
Yes.
For me, because I'll be able to acquire my master degree after finishing my clinical placement here. It's different, the communication between patient and the doctors and the nurses, like they are all in the same page. There is no much differences. Back at home in UAE, like you have different people coming from different backgrounds, so like the communication is a big issue, like understanding the culture of the UAE and understanding the culture of the doctor and the nurses. So there is a lot of clashes happening, and but here in UK I feel like they are all in the same page. Families and the patient, from my point of view, they are very polite. They stick to the rules. Nurses have like patient-centered and family-centered care, where they really involve the family in the care. Where I think back at home, it's mostly the shift is on the doctors and the nurses and what they think. They might take in what the family might think, but it's mostly medical field driven decision making, or a plan of care. So I think this is will add to what I will take back home, the communication and having putting the family and the patient in the middle of the care.
That's really wonderful. Thank you very much for that. So one thing that I was wondering during that then is, would you say that your health career in your country is popular? So how does it attract attention? So moving from the benefits, how does it attract that initial attention? How do you get people to study?
Um, if you go back home, like in UAE, there is not much UAE citizens who studying nursing. Now they started like few only, but most of those who studying are from other Arab countries. That for example, I am from Somalia, but I lived and uh, I was born in UAE. So most of who's attending the nursing professions are from different countries, and nursing, it's changing now with the COVID and all of that, but still there is stigma about nursing, and they don't look at it like it's a higher level of a profession. Like while I'm taking care of the babies, one mother will tell me, "Oh, I want to be a nurse." Then when I tell her like you have to go and study for 5 years and you have to take your English exam, and she will say, "Oh my God, all of this because of nursing!" Like it's not considered like a high level of, but things are changing now, and I think nursing plays a major role in healthcare settings back at home. So hopefully in the future it will be even better.
That's really interesting. Thank you. It's very interesting also that you touched on the stigma as well. I was curious to know about that. So, Susanna, would you mind telling me a little bit about any stigma in audiology? Do you think are there any kind of things that are still poorly understood about audiology from a general point of view?
Okay, I will, but can you please tell me what do you mean by stigma?
Oh, stigma is just how do I define stigma? It's
Something that's
just kind of
understood wrong.
misconceptions or things that people necessarily don't understand about the profession.
Yeah,
Generalizations that
definitely. I'd say mostly audiologists are seen as hearing aid dispensers. Like they only want to sell you hearing aids. Like most people think that audiologists are lying to you. You don't need the hearing aids. They are just trying to make money out of you. And I think that's a misunderstanding, and we need to raise awareness about hearing loss and hearing loss prevention and all these stuff, because I believe audiology is not like popular enough in Jordan, and hearing losses are not taken seriously like more other problems. Um, yeah, I'd say that's it.
That's very good. Well, thank you for that. I think as also an audiologist, I often really try and highlight the importance of hearing health because it's quite a big it has a big impact in the elderly population all over the world. That's something that's very global and unique to every country. And I think as an applied healthcare profession, it's something that's very important to continue looking for ways to promote well-being across all levels. I think this is very good. Okay, thank you. Okay, would you encourage other practitioners in your country to consider working in environments such as the NHS? Why or why not?
Um, During my master's degree in audiology here, I had the opportunity to do a placement in the NHS, and I found it fascinating because I had the chance to work with different practitioners in different fields in audiology, and I had to learn like a lot from their experiences. Um, Okay, so I had to work like in a hearing assessment clinic, rehabilitation and hearing loss management and BAHA and all this stuff. And because I got to experience different perspectives and learn a lot from the professionals' experiences in their own individual specialties. It was so important to me because in Jordan, audiologists mostly one audiologist runs the whole clinic. So one audiologist like does the hearing assessment, do the hearing aid dispensing and all these stuff. Like learning these stuff from like specialists is like so important. And also because the NHS provides the opportunity to um, one of the NHS benefits is that the treatment is free for the patients. So you'd get to put like the money would not be a problem, and you would get to help patients to the max, because and also another thing that I found really interesting here in the NHS is that communication for them is like extremely important. So because their priority is to ensure their patients' satisfaction at all costs rather than just simply getting the job done.
Well, that's wonderful. Yes, thank you for that. Yeah, I totally agree with that. And it's interesting that you touched on placements as well. Rafan, as a medical student, how did you find your placements initially when you came to the UK?
So for me, I've been in working in A&E from the start, and
Okay.
it's something that I've been. It's a career that I want to go for in the future as well. Uh, I would say the most important thing for medical professionals coming here would be to come with an open mind. A lot of us, so working in the Middle East, especially Saudi Arabia, you have a lot of professionals coming from different parts of the world. You'll find a lot of doctors from Egypt, Pakistan, India, and a lot of them will come and bring their practice, but there's no standardized practice there. Versus while you come to the UK, we stick to your nice guidelines. We have hospital driven protocols. So, for example, uh, I when I'm working in the department now, I see a lot of people. For example, let's take DKA protocol, which is diabetic ketoacidosis, and we follow a standardized protocol in every hospital, which is run by the NICE guidelines, and that isn't so easy for people to agree with initially. So coming to the Middle East, from the Middle East, I would say people need to come with an open mind that the system here is a bit different. And once you settle in, it makes life much more easier. You have a protocol for every single thing. Every single thing is audited. Every single thing is looked into. You have great support. You have great teaching platforms. So overall, you're taken well care of. You have to come with a bit more open mindset.
Hmm. That's really, yeah, wonderful. I totally agree with that as well. Thank you very much for that. Okay, is there anything that you would do to make it easier for practitioners from your country to move to the UK then and work in healthcare? Can I get an opinion from a nursing background, someone from a nursing background?
So,
Hello. Yeah. So is it Chris? I think if he's talking, it's fine.
go on. I'm gonna go on. It's all right.
I'll follow you. That's fine.
Okay. Sorry, I didn't get what was your question again? Sorry, Tom.
I said, is there anything that you would do to make it easier for practitioners from your country to come and work in the UK in healthcare?
Like, how may I help them?
Like, would you suggest any kind of recommendations to make it easier for people to transition?
Uh, yes. Actually, I'm doing like I had a lot of my friends who are still working in the Middle East, and they're really interested in working here. So what I'm basically doing is like telling them and explaining how like worth it to work here in the NHS because there's a lot of room for growth, and so it's just basically like taking the exams you need to prepare and those kinds of things. It's like helping them, giving them the right materials that they needed to. Yeah, I guess. Yeah, and just really like promoting how well NHS that I am in are to them.
Hmm. That's really good. Thank you very much for that. Charlene, were you going to say something as well?
Yeah. I just wanted to say that, if I would want anybody to come to the NHS, yes, I would give them all the positive feedback because what I heard was totally different. And I thought, but when I came here, I found that it's not that difficult. Yeah, if you have the proper determination and you have the great support from the NHS, I think the career paths are very easy to go ahead because really I find that there is a lot of support here. I mean, even when I had a transition, I came here coming from a pre-hospital professional back into a hospital professional is not an easy go because it's a big shift. And but here when I entered the hospital, I was given a lot of support, motivation, how I could do everything, and everything is in place. So if you have the good people around you, I think that's the best platform which can attract. So what I do is basically I have my friends as back in the Middle East, even in India. So whenever they ask my experience, I always give them the positives, because when you start putting up the negatives, then people tend to go back, put a step back. But it's not like that with the NHS. I can say that some years back, it was very hard to come to the UK. It was not easy for nurses. But I guess pandemic opened the door, so a lot of nurses are now being embraced to come in, okay, and they're giving you the full support. They're even giving you, they're also funding for your examinations, for your flight, for your stay for 2 months. I think that's a huge platform where NHS is bringing out. I mean, they want to support us. So I think that's the best thing ever. So I think that is what I can tell them. It's attracting, and trust me, they can grow heights if they are once in the with the NHS. That I'm pretty sure about that. So that's what I keep telling all my colleagues and friends.
That's really good. Yeah, I really admire that. Thank you very much for that. Okay, then, is there then, following on from that, is there any piece of advice that you'd give to those wanting to come and work in the UK from the Middle East? Kind of any wise words?
As an audiologist, I would say if you want to come work in the UK, by all means, just do it, because there are a lot of opportunities here. And I agree the workload may be insane, but it's definitely worth it. It is a gorgeous experience. You'd get to enhance your knowledge in all the fields, and do it.
Very well then. And how about from a medical perspective, Rafam? Do you have any advice for those wanting to pursue medicine in the UK?
I mean, especially now after COVID, there's a lot of influx of medical doctors coming in from the Middle East as well. My most important point, and I think it would go for all healthcare professionals, is be come with an open mind, be willing to accept the change, mix in with everybody else rather than just so if you feel, for example, someone is coming from the Middle East and from a more Arabic dominated background, to try and not stick just with the Arabic people, try to assimilate with everyone, because that will make their stay much more better and enjoyable. Because at the end of the day, NHS is multicultural. You have people from every, like in my department itself, I have people coming in from India, you have people from Egypt, from Somalia, we even have people from Sweden working with us. So it's quite a multicultural place. And if you're willing to give it a try, come in with open mind, yeah, it'll make your stay much more better.
Fantastic. Yeah, I totally agree. And Chris, from a nursing background, what advice would you give to people are looking to come and work in nursing in the NHS?
Yeah. For nursing views, it's like the same as like Rahman. It's just like putting yourself with an open mind when coming in here, especially with the culture here in UK. It's well, oh, sorry, hold on. It's well diverse. The only thing I'm gonna add, like when I came here at first, I was a bit like um what you call this, a bit anxious because it's really different when I was like working in the Philippines and I was working in Oman. It's totally different. So you're gonna learn everything, and you need to take in account that everything is needs to be trained. But it's with the help of everybody. Everybody's approachable. You just need to ask, even the doctors. So it's like just to have an example, it's like when you're starting a shift, so you're gonna do like a board job. We don't normally do it in the Middle East or in the Philippines. Like we do have a multidisciplinary team with the occupational therapists, with the physiotherapists, or everyone involved with the patient. And it's really inspiring and motivating to work like every day. Like being a nurse before, my voice is like it's not valued, but here in the UK and the trust that I'm working with, it's really valued with the doctor. Like the doctor's just gonna ask like you, what, um, how you can help them, like to improve the patient's or well-being, or how to give the best care there is for the patient. So yeah, I guess that's the best thing I could advise for.
Yes, Yeah, that's wonderful. Really, really wonderful. Thank you very much for that. Okay, that is the end of my questions. So for this next 5-10 minutes, what I'm going to do is I'd like to invite members of the audience to ask any questions to our panelists about their experiences. So people watching at home on whatever platform, if you would like to ask any of our speakers a question, please put your query in the chat box on this page. And I invite the speakers then to answer them to the best of their ability. Do you have any questions well for the panel? Do you have any questions for me about the NHS or about your experience? Any reflections?
I want to ask Tom, in general, like for nursing or healthcare providers, is there like an age limit where they can become a nurse or a radiologist or a doctor, or they can join whatever time they want?
I'm sorry, I didn't quite get that. Would you mind just repeating the question again?
So I'm just asking because back at home, if you want to become a nurse, there is like an age limit. So if you are older than that age, you cannot study. So I want to ask, is that the same at NHS or UK?
As far as I'm aware, there is an age limit. Yes, just because of the how difficult it is to get into nursing. But I believe that most nursing is accessible at roughly about the age of 18 as an academic course in higher education. So I think after that, and once students have got into that qualification, then they can get the training they need and register as a fully qualified nurse after that. So I suppose I mean, there is no age limit, but when it's necessary, people can get access to it, and they just need to discuss whatever concerns they have about training and qualification with the supervisor once they actually get access to their training. We have a question here saying, having heard about a possible standardized NHS induction for international healthcare professionals in the previous session, do speakers think that this would be a constructive addition to the process of relocating? So standardizing NHS induction for international healthcare professionals. Does anyone have any opinions about how this would be?
From the medical point of view, I think it'll be a quite helpful thing, because people coming from abroad, NHS is a big system to understand, from how GP settings work, for example, and the medical side of things. GP setting in the UK is vastly different from someone coming from the Middle East or India, for example. How the community services work. So not just, I would say, even including how the social system and the community system work would be a quite good addition. In at least in my trust, for anyone coming newly from anyone joining new, regardless of what level they are, they usually get about 6 weeks of shadowing, where they get to learn, first shadow people, and then learn hands-on how to do it while they're still learning to adapt to the system. And yeah, I think it would be a good thing to add, but it depends on how they plan to implement it. Would it be a trust-based thing or a registration council-based thing? That would be up for debate, but yeah.
Yeah, totally agree. Yeah, very good. Okay, we've got another one here that says, what advice would you give to people who are considering changing their career to join healthcare? So be it nursing or medicine or other healthcare professions.
Yeah. What advice would I give is that, joining healthcare is not easy, but then it's a challenge. So if you're ready to accept challenges and pursue your career further, I think that would be a real great help. And I could always say that you need to be very challenging and be open to adapt to the changes with the healthcare, because healthcare system keeps changing from time to time.
Hello, Tom. Where are you, Tom?
Okay, so the question says, do you need any specific qualifications if you want to work with health professionals coming from the Middle East, for example, and to help teach them? Well, as I mentioned before, you need to be qualified to be registered with HCPC, and there are many routes to doing that. You do not only need like a bachelor's degree; you can do it in any other way, but you need to look further into this prior to coming to the UK, just so that you'd get it figured out all before like moving on and like getting a visa and doing all this stuff. What would you guys say?
Yes, from a nursing background, I think this is like specific qualification means like just being having a bachelor's degree, I guess. If you're gonna go for a registered nurse here in UK.
Uh,
Um,
I had the knowledge to know that there is nursing assistants where they need to take only 6 month course to work as a nurse assistant. So if they don't want to be like a registered nurse, that they need to study for few years. There's other courses, and then they can like as a starting point, then they can work their way up to studying and being a nurse.
Yep, that's true.
one more point I would add, guys, for the medical side of things is over the last 2 years, because of the restrictions of pandemic and medical staffing, clinical attachments were not so available. But for someone coming from the medical point of view, I think they have started doing clinical attachments again. So if you are working on your PLAB or have completed your PLAB and are applying for jobs, and in the meantime, uh, want to get experience in your field, there are many departments all over the UK who are giving clinical attachments. So look at different options. If you want, if you have, for example, if you're still in the UK and you're waiting for your GMC or stuff, try to get some experience. Try to see how uh, the work is in real life in the NHS, and then you can gauge from that how you want to go ahead.
All right, there's another question. How do you see the future of healthcare? Anyone want to answer it?
So from medical point of view, uh, I'm sure everyone over here is on Facebook, I hope. uh, and uh, you will see a lot of messages of people going, oh, there's saturation in the NHS, there's no jobs left anymore, when actually, trust me, in reality it's way different. I've been working in the A&E, and you always have gaps. You always have place for more people, and it's about looking under the positive side of things. Healthcare is not going anywhere. There's not going to be any AI input anytime soon, at least in the next few decades. So if you are really going for it, put your study your options, look at what your long term goals are, and yeah, there's always going to be opportunities in the NHS. If you read negative comments,
that's really wonderful. I'm very sorry for dropping out there. We had some technical difficulties this side, but I was just listening into what you were saying, and it was some very, very good feedback. Would anyone else like to answer that question before I move on? Just because this is quite an interesting point. How do you see the?
For me, like even if it's the future where maybe an AI will be involved, healthcare system still needs the human touch, still needs people involved, and there will be an open opportunities, a lot of job description that might not be available now, but in the near future it will be. So healthcare will not be about doctors, nurses, and other healthcare providers. It might extend to other job qualifications, where it is more to giving support to patients and family. Um, and this is what I think. Like even in the future, human touch should be there.
Yes, no, I agree completely. There always, I mean, because healthcare is you need that human part of healthcare as well. Because without humans, we wouldn't kind of establish that effective communication that exists between patients and practitioners. So I really do agree there as well. We have one more saying, may I know what common pathway medical graduates or intern doctors would use to get into NHS? Would it be F2 standalone pathway, or are there easier ways than this? This is one for the medical delegates of our panel.
all right. Could you put up the question? The thing, it sounded a bit long. I think it's
Yes,
there.
of course.
Yeah. So depends on what. So that can be answered in a long way, but making it short depends on what level you're coming in. So coming in from an entry point of view, you will start at, nowadays they're doing a lot of clinical fellow jobs. So you can join as a trust SHO, or you can start as a clinical fellow with some non-clinical time to develop your portfolios. And that is something I would recommend for people to come to, because to get into training programs, you have to first understand how the system works. There are a lot of people who try to get directly into the system. That's, I think, a difficult way to adapt, because you have to maintain your portfolios. There's a lot of non-clinical work that goes into it. So at least coming in for a few months or a year to get adapted to the system would be great. So look for junior clinical fellow jobs. Look for jobs in fields that you want to pursue, or if, for example, you want to try a different avenue and see weigh up your options, go for that. If you're coming from a more registrar kind of a point of view, you will end up most probably doing your registrar exams and then coming through GMC rather than the PLAB. So then again, look for senior clinical fellow jobs and see whether you can get into an ST3, ST4 program, or if not, go through Caesar to take your career further. I hope that answers the question.
Thank you very much for that. And whoever said that, I hope that answers your question. That was a very thorough response and very informative for me as well. Wonderful. I will just give another 30 seconds or so just for anyone else to put any questions in on the chat. But if not, we will draw this panel to a close. So before we go on, I'd like to just say thank you very much to everybody who joined. And I hope this has been a very wonderful, enjoyable experience for you. I hope we've learned a lot. And I very much look forward to seeing what you do in the future. So I'm just going to give it a few more moments, but it doesn't look as if we have any more questions. So in conclusion, so thank you very much, and I will be in touch. Good luck and enjoy.
Thanks for having us.
Thank you. Thanks for giving us the
Thank you,
opportunity.
Tom.
Thank
Thanks
you.
a lot.